So, how appropriate we're going to talk about food today when you're eating lunch. As a dietitian, trust me, I'm not here to scare anybody. I'm not here to correct anybody's habits, okay? I am just like everybody else. I have enough bad habits when it comes to food, okay? So let's go ahead and get started. Nutrition Counseling Unplugged. All right, when it deals with nutrition, being a dietitian, it can be a fairly rigid career field, okay? You're told to do this. Why aren't the patients doing this? Especially as an inpatient dietitian, which I'm not, but I had some training when I became a dietitian. You know, inpatient, you might see the patient for 15 minutes if you're lucky. I trained at a very large hospital, the Christ Hospital at Cincinnati, Ohio. You had about 15 minutes to tell a patient, you have diabetes, you need to get it under control. Good luck with that. I mean, if they have any questions, you basically have to say, well, no, you know, you're going to have to set up a later visit with me because that's not going to work out. What I do here, I work in the Surgical Weight Loss Center, which is across the street. I guess it'd be over there. And so I work with a multitude of different patients, but with the primary focus of weight loss. So a lot of this is going to be geared towards weight loss. In America, that tends to be the primary problem in America. But nutrition counseling defined, a quick definition there, a process by which a health professional with special training in nutrition helps people make healthy food choices and form healthy eating habits. It's not as easy as a meal plan, okay? When it comes to nutrition counseling, it is patient-focused. It must remain patient-focused. What I mean when I say that, dietitians in general, I know this. I've only been a dietitian for a few years, but I know this. It tends to be cookie cutter, all right? If you have diabetes, you need to be on this diet, okay? If you have any kidney issues, you need to be on a renal diet, devoid of all electrolytes, devoid of fun, okay? It can't be that way, okay? With some particular subsets of patients, it has to be that way for them to live. For most people, it doesn't have to be, okay? You have to work within what the patient is able to work with, all right? And I'll describe that here in a second. Nutrition counseling, we aim to achieve the goals of the patient. Especially, you know, for inpatient dietitians, they have their goals. I have my goals, okay? To ensure the patient loses weight at a very healthy standpoint, okay? But if that's not what the patient wants, you're kind of butting heads. You have to work with a patient. So that's something as a dietitian, you must establish the goals with the patient with a focus of having them set their own. It says here in the third part, focuses on the dietary components towards changing one's health. It's a very, I mean, food is everything for people. It really, really is. You take that away, only then do you realize it makes a big, big difference on their health. So we try to tweak that. Even if it's a subtle change, it's a change. And the problem with a lot of, not dietitians, but food in general, if someone's dietary habits are bad, all of a sudden somebody tries to come in there and swoop them up and change everything about them, okay? If I was to change or try to change anyone's diet in here, okay, do a complete 180, chances are that change, that immediate change, isn't going to be lasting. But small steps towards better health, they go a long way. Lifestyle focused, I'll talk about that here in a second. The last one there says interventions are usually priority based on various different levels. In the example I gave there, an extremely high blood sugar, a patient comes in with extremely high blood sugars, should be addressed first before focusing on the benefits of organic foods versus traditional foods. You got to focus on the micro change, okay, before you really worry about the details. And I've actually had patients tell me that. I had a patient one time that came up to me and said, "You're going to get cancer." I said, "Well, how am I going to get cancer?" And she saw that my coffee had a plastic spoon in it. And she had just seen something on TV to where using plastic can apparently lead to cancer at a later date. I said, "We need to focus on the big change." And her change was, she had weight loss surgery, and she was bragging she could eat 2 slices of pizza. Okay, so maybe it was a little bit geared towards, you know, but that's what we need as dietitians need to focus on. Even inpatient dietitians, if a patient has a lot of dietary problems, okay, and tries to address a small one, okay, that really doesn't mean a whole lot, like traditional foods versus organic, no, you need to focus on what's most important, especially for inpatient. All right, so focusing on the individual patient. These are some of the concerns, some of the problems, some of the habits that the surgical weight loss patients that I deal with, that I treat, that we have to go through, okay? It says many different variables define and shape one's dietary lifestyle. Schedule. Schedule is huge, Huge, huge. For a lot of people, it's not that their dietary habits are bad. They just need a better schedule to accommodate a healthier lifestyle. Stress, emotional health. We do work with psychologists from the surgical element. We do. How you cope with your emotions, stress, is really tied into one's health. If you're coping with food, chances are it's not very healthy. You know, the eating before you go to bed every night, the ice cream, things like that, when you're not really hungry physically.
On, man.
I know. Like I said, I'm here to take it away. Things like that we do deal with, okay? Family support. It's very, very important. If you're wanting to change something in your life, especially with regard to food, you need some support. Okay, I'm sure everybody knows that. About any big change in your life, it's helpful to have a partner that says, you know what, you can do that. Especially dietary change, it's very important to have family support. If not family, some good friends. Cultural habits, give you an idea. In this area, especially I had worked through LJH for a couple years, and we had a lot of patients come in, Hispanic descent. They love the rice and beans. Well, what is rice and beans? It's all starch. Okay, so especially after surgery, we really don't want the patients having a lot of starch. So for them, that's a huge cultural barrier that they're up against. Even if they're family supportive, what if they don't make the food and their family continues to serve rice and beans? That can be a big issue. From the dietary side of things, you need to worry about. Social environment, you are who you hang with. And that's something we've dealt with before. Is it tied into nutrition? As a dietitian, we talking about that? Not necessarily, okay? But we all know, if you hang out with a bunch of drinkers, chances are you might drink a little bit, okay? If you hang out with people who have a tendency to frequent buffets, chances are you're going to be partaking in that particular behavior. That's where it can do you in. I went ahead. Oh, no one told me. Okay, food environment, that's very, very important. If you set yourself up for success in the household, chances are you're going to be good. Okay, you're going to make those dietary changes. But if your kitchen's filled with nothing that's going to support your weight loss or better your health from the dietary side of things, it's kind of tough to make that change. As a dietitian, that's one of my first goals I work with patients that I try to. Almost like a pantry makeover. You got to change up your environment. If you're trying to change up your health from a food perspective, it starts in the kitchen. In knowledge base, as a dietitian, even going through school, we talk about food, how to change it up. Basically, in a nutshell, you could say knowledge. You're trying to change a patient's knowledge. All right, but as we're going to talk about here, it's usually never their knowledge. People know what to eat. Okay, it's really hard making that change last. So the tenets of nutrition goals. As a dietitian, that's what we do with patients. We try to set up some realistic, some tangible goals each and every visit. And that's what's very, very important. It says there on the top, find out patient's motivation for change. It's very important to know why the patient wants to change. Is it purely aesthetic? Do they want to look better? Or is it they just found out they have diabetes, high blood pressure, their triglycerides are through the roof, cholesterol is through the roof? Chances are that patient has more motivation to change as opposed to aesthetic. The second point there, find out what the patient wants to change with regard to his and her lifestyle. You may want them to get rid of all the fast food. What if they're not willing? You have to work within that. Okay, I'm here to tell you, even eating fast food, you can lose weight. Is it going to be tough? Yeah, it's going to be tough, but it's possible even. Focus on concrete goals, not broad. As a dietitian, working with food, you really have to. Okay, broad-based goals such as, you need to stop drinking coffee every day. Well, I shouldn't use that one. You need to reduce your starch intake. You need to reduce your starch intake. What kind of goal is that? By how much? Okay. Yeah, exactly. So we give out examples for what would be considered one carb count, 15 grams worth of carbohydrates. And I might say, have 2 servings of those per day. And they say, what servings? We have sheets, we hand them out and say, these are traditional servings, we want you to reduce your starch intake by. That'd be a very tangible, very concrete goal. Aim for progressive change. That's what we're looking for. Okay? The first couple goals you give somebody, especially if you're trying to initiate dietary change, okay, work your way up to big goals. You can't give them a huge change and expect that to last. Give them a couple little goals, see if they can work with that. Because if they can't work with the initial goals, chances are they're not going to work with huge, huge goals. Realistic goals should only focus on a couple of manageable changes for the patient to make. When I first got started as a dietitian, I was very, very excited, wanting patients to change up everything. Then found out they're not listening to me when I do that. Okay? Manageable changes, like I was saying earlier, those are the ones that really stick, and that's what matters. And I made this point earlier. Sweeping changes usually don't last. Yet slow and steady goals usually fare much, much better. Okay. So as a dietitian, some of the things we use, food models, okay, with regard to portion sizes, food identification, identifying the patient's knowledge base. When I first got started, I didn't really have those tools to use, and it's very hard without food models to really see the patient's standpoint. If the patient wants to change but doesn't know how from the knowledge standpoint, that's a dietitian's job to ensure that they're up to snuff. Nutrition handouts and meal plans, we provide those. A lot of patients have found success with that as long as they're kept simple. Okay, the problem with any diet book out there, a lot of them anyways, they're hard to follow. They're very, very hard to follow. Whether it's the Atkins or even the high carbohydrate, low fat, most of them are hard to follow. You need to keep it simple, and that's my philosophy with regard to nutrition. We do use motivational interviewing. Raise your hand if you know what motivational interviewing is. Okay, you want to talk about it for like 2 seconds.
Oh, great.
I call it.
Not really, but motivational interviewing, I'm a social worker, so we use it mostly with a lot of our drug and alcohol patients, but it's basically, it's very client-focused, it's very much so focused on not asking, so if you want to know how much they're really drinking, rather than asking how much are you drinking per day, you could say, so you're drinking 12 cans of beer a day? And they'll say, no, I'm only drinking 8. So, I mean, it's kind of a different way of interviewing someone to get the information that you need.
Exactly. With motivational interviewing, you're also trying to assess their motivation for change. Okay, the questions on a scale of 1 to 10, how motivated are you to change? Well, I'm a 6. Why aren't you an 8? Just to create some dialogue, and that really does help. Plus a patient, someone saying their goals, kind of working with their goals, with what they have, that really does open up a wide array of things from which you can manage, you can deal with. And I found motivational interviewing, especially patients that are very ambivalent about dietary change, it helps a lot. It really, really does. The last one there, tangible goals set with the end goal in sight. Okay, whether it's weight loss, blood sugar control, renal diet. A problem a lot of patients make is, I'll ask them, what are some goals that you have? Well, I want to get healthier. I want to lose weight. Duh. I mean, of course, we know they do, okay? We want more than that. What else do they want? That's what, as a dietitian, you need to know that, okay? Especially, because what happens if you're headed in another direction that you think is health for them, but it's not the direction they want, okay? If a patient wants to lose 150 pounds, I want to hear that, okay? I don't want to hear, I want weight loss. Well, 10 pounds is weight loss, but it's a big difference between that and a much larger number. All right, so here's my my last slide, and I'll get your guys' way so you can enjoy your food or drinks. Dietary change doesn't come from simply knowing nutritional knowledge. That's very, very important. In America, I don't think it's the standpoint people don't understand what's good for them. Okay, it's not. It's usually the application of carrying out healthy habits. Dietary change addresses many things, not just food. Like I was saying with regard to one's habit, there's many different social elements or one's habits that make a big, big impact upon food. All you can eat lunchtime stuff, that can make an impact too. Third point, support is needed for sustained dietary change, and for many people, it's certainly crucial to success. Support is so, so important. That's always one of my first questions I ask somebody. Do you have family support? Do you have friends that are willing to stick it with you when you say, you know what, we need to change out where we hang out? Instead of these family events where food is made readily available for 6 hours, let's change that up. Let's be more active participants in life. There's no diet that is a cure for weight gain, okay? And I'll be the first to say that. And there's no perfect diet plan for everyone. Has anybody heard of the Twinkies Diet? Okay, does it work? It depends what your definition of success is with regard to that. You'll lose weight on it. Missy, if you have 3 Twinkies a day, will you lose weight?
Yes.
Yes, you will. Okay, so it's a matter of calorie reduction. Okay, will you be healthy? Sorry. You probably won't be healthy. Okay, but Twinkies are delicious. See, dietitians saying Twinkies are delicious. So, but the thing is, that's why there's so many diet books out there. Okay, they all call for keeping your calories underneath where your body burns. Okay, calories in versus calories out. You can make a diet book eating bread all day, and you're going to lose weight, as long as it's not a lot of bread. Okay, but that's where dietitian comes in, making healthy dietary suggestions, dietary tips. Consistency is needed for long-term change. That's why if you focus on small progressive goals, chances are it's going to hold true much longer. It's going to be much more consistent. If you change everything up, make big sweeping change, it's not lasting. More times than not, it's not. And the last point, long-term dietary change and weight loss isn't achieved through quick fix diets and diet pill supplements. Growing up, a few years back when I got out of the Air Force, I had worked at Vine World, I worked at GNC. All right, not to slam on those places, those are quick fixes. Why do you think there's scales outside of GNCs? Do you guys remember those when I used to have those weight scales? Put 50 cents in there and it pops out a number and says you're this much overweight. Okay, by what standards? By very, very low standards as far as the weight requirement. And then you'd be more inclined to buy something to help you lose weight. I sold diet pills, okay, and I'll never forget this, to two mothers. They were probably about 50 years old, eating ice cream. Yeah, I laughed. I'm not even gonna, I mean, I laughed right at them and said, what do you guys want? I felt obligated to sell a multivitamin or something as opposed to a diet pill. But yeah, with regard to dietary supplements, quick fix diets, I don't care if it's Bob and Jillian selling their diet pills. They don't work. And if they were here, I'd tell them that. Okay, it takes more than just a pill to make lasting change. Okay, that's my tough stance. Any questions, you guys, gals? Go ahead.
What do you do with the families and the people that you meet who are low income?
Low income?
And they say to you, you know, it's for a lot of them, it's cheaper to buy some of the, you know, the rices and the beans versus trying to buy the organic, as we all know, which is very expensive.
Yep, yep.
Do you tell them where to go to get the cheaper end food?
Yeah, we do suggest that. Something I also focus on. How much are they eating out? Because if they say you can't afford something, I say, all right, how many times a month, how many times a week are you eating fast food? That usually stops them in their tracks. Hate to say it, but it usually does. Okay, eating in general, okay, whether it's poor or even healthy, is expensive. Okay, where you shop does make a big difference. I'm probably the most frugal person out there. My wife would tell you that, and she's frugal too. You can make it work, even with not a lot of money. You can make it work for you. Yeah, yeah, you can.
Isn't exercise a very important part of your diet?
It is. It is. We do work with an exercise physiologist. And I'd be the first one to tell him people don't gain weight from lack of exercise. They gain weight from food. I mean, I know a few hundred patients, and out of a couple hundred that I know, probably 300 that I know, I'd say 100 regularly don't exercise. They'll look me straight in the face. I don't exercise, but my diet's good. Generally speaking, doors shut here, our older patients, I say, would do pretty. They do really good, okay, because they know they can't work out 4 or 5 days a week like the young pups can, okay, so they make food a big priority, and they kick tail. They do, yep. If there's any one thing you change, is you make it nutrition, that'll have a lasting impact as compared to exercise. You might not be as functional, you know, getting up and getting down, but it will make a bigger difference on your overall health, I believe. Yeah.
The size of the portion is important. Someone said the portion is as big as the palm of your hand.
Well, for particular foods, yeah. Yeah, portion size in America, especially those who eat out frequently, the term portion distortion holds true. If you eat out, you're gonna have. If all you did was eat out at Cheesecake Factory, okay? I see a couple smiles. You're gonna be surprised to learn that's not a portion size for a healthy person, okay? We do practice that as well. Moderation has to be key. With regard to what type of diet you're on, moderation is so important. Yep. You don't always get it though. It's tough.
I was just going to ask you about moderation.
Moderation is important. The surgical element certainly helps that though. It does. So we have a little trick in our head, in our hand. Go ahead.
You ever work with people who have eating disorders?
Eating disorders, to be honest, no. But we have a dietitian that did that for 7 years. So where I can't pick up, she picks up and helps out with that. Yeah. Whether it's both ends of it, you know, guys who want to be bigger, weighing 400 pounds, that are happy with that, even as opposed to females that weigh 110 pounds that think they're obese. Yep. Yeah, with Nicole Lefevre, she's one of our dietitians. She can be seen on Fox 43 now about once a month. She does talks and things like that. She has very extensive on-the-job training, and I mean, she did that for 7 years. She loves doing that. Yeah. I don't have nearly as much training as her when it comes to that. All right, I think my time's up.
Make this personal?
Go ahead. Go ahead. Here it goes. Okay.
Here we go. Well, I love food.
Yep.
And my wife is constantly hitting on me portion control, like Gene just mentioned.
Yep.
So what is something that I can tell myself that I love I love tasty food, so.
There's many different things we can do there. We could say, you know what, cap the minutes that it's going to take you to eat a meal. If it normally takes you 40 minutes, cap it at 20.
See, I didn't have enough time to eat today.
Okay. So you're making up your calories, right? Okay. There's many different things you can do. Even if you switch up to start consuming foods that fill you up quicker, vegetables, they fill you up. Carbs don't fill you up, okay? Not to say I'm an Atkins admirer, okay? Carbs are very bad for one's diet in excess.
So
Okay,
have
moderation
an
is
excessive
fine.
amount of vegetables over.
Not an excessive amount of anything, but I'd start with vegetables. Have protein. Protein is very thick. It's very dense. It's certainly a filler in one's diet. Yeah. But yeah, non-starchy vegetables, I've never met any patients that gain weight because of them. Think about that. Do you know any patient or anybody in your life that they have a weight problem because they eat too many vegetables? Maybe if it's corn and potato, but you take those out of the equation, it's usually not a problem. Yeah. That's a very open-ended question you threw at me. I didn't give you a good answer, but I'm sticking with it. Go ahead.
Well, one thing I do is I get on my scale several times a week
Okay.
in the morning.
Okay. In
and-
birthday suit?
Pardon?
Birthday suit? Well, then it's reliable then.
He said, in your face, which would be no clothes.
Well, okay. In my pajamas. But,
Okay, that'll work.
But after I get up and relieve myself and so forth.
Yeah, good. Good. Yep.
Before I have breakfast.
I think that's very important, especially from the standpoint, if you're motivated to make change and you're actively making dietary change, working out more, things like that, I think from an objective standpoint of success, you have to jump on the scale. Okay? I wouldn't do it 3-4 times a day. I know some people that do that. But I think once a week, not bad. A couple times a week, that's okay. But it's just a number. You'll know how you're doing. You don't have to step on the scale. You can say, you know, I've been doing pretty good. Or, geez, I don't think I've been doing very good. Go ahead.
I have never gone to scale, nor would I ever go to scale. Because that, for me, having had an eating disorder as a teenager,
Okay. Yep.
it can get mentally obsessive compulsive.
Yep. Yep. If it ruins your day, don't do it. Yeah.
I go by my clothes entirely.
See, that's another way to do that. Yeah. I wish clothes were all standardized, though. The sizes don't add up. My wife lets me know that. Go ahead.
Do you advocate increasing the metabolism by eating more often?
I really don't. Because the problem is, you may go from eating 3 times a day to 6. But what happens if your portions are slightly larger than you want? Then you mess up 6 times in one day, as opposed to 3. Yeah.
Still portion.
It's our pragmatic approach. But yeah, go ahead, sir.
A suggestion for people who are portion challenged: get a sandwich and eat half. Get soup and half a sandwich. Get soup and a salad. It's cheaper.
Yep.
Cheaper is good at the restaurant. And I had a gal that I followed after her advice, and she said she had 5 rules to live by for the rest of your life. And number 1 was exercise 30 minutes a day. And for 2.5 years I could do that, and I did that. And now that I had my eye mishap, I can't, but I'll get back to it. But I found that made a big difference many times, if not physically, mentally, just to be moving.
Yeah, especially when you talk about the release of endorphins and working out and things like that. It won't cure depression or anything like that, but I'm telling you, you start your day out with exercise, more times than not, it's a good day. You might be tired come 9 o'clock, but it's a good day. Go ahead.
What's your opinion on, I don't know if it's myth or not, that if you don't eat enough calories, you won't gain weight?
You mean you won't lose weight if you don't eat enough calories?
Yeah.
That whole theory has been popularized on The Biggest Loser. Our patients, first couple months after surgery, maybe 600 calories a day. We're giving them vitamins and they know what to take and they're drinking their fluids and things like that. It does hold true. You have to eat to lose weight. So there's a certain range, especially long term. We want our patients on at least 1,200 calories a day. Or else
So if you eat under that, your body...
Well, I'm saying like long term. During the first year, because of the surgical element, especially weight loss surgery, you're going to see very good weight loss. But we'll know if someone's not eating enough, you're going to burn through your muscles. It's very hard to get muscles back. That's what we worry about with anybody dieting. Diet books don't care about that. They might make reference of it. I've seen muscle wasting, and that's so important to eat your protein. You know, I've known someone that did the smokes and the salad diet, worked very good, okay, if you went by the scale, but she was passing out. So, and she wasn't getting nearly enough calories, and she lost all of her muscle. That's hard to get back. Yeah. So low-calorie diets, you need your protein if you're going to be on a very low-calorie diet.
But if you have a little bit of muscle, then you can also eat, because the muscle uses up more calories.
That's right. That's why guys tend to burn a little more calories. Sorry, ladies, but not a whole lot, just a little bit. Well, I hope I made your guys' lunch fun.
Appreciate it.